What's going on, everybody? Mike Taylor, student, physical therapist, coming at you today. Got a good one here today. Today we're going to be talking about low back pain, something that I would imagine most of you can probably relate to, at least on some level. And the reason for that is low back pain is actually responsible for 50% of outpatient physical therapy visits and is the 5th leading cause of general medical appointments in the United States. So it's a huge issue that lots of people are having problems with. So today we're going to talk about what we can do about it. It seems like everybody at one point or another has experienced at least an episode of low back pain that has really just been essentially debilitating and kind of put their life on pause for at least some amount of time. It can be overwhelming to think about all of the various kind of scary diagnoses there are. So you can have a bulged disc or a pinched nerve, and it can be scary to think about that kind of stuff. And even if you did know exactly what was going on beneath the surface of your skin, how are you going to know what to do to help yourself? There's countless forms of exercises and modalities and gimmicks out there, all used to address low back pain, but it can be really difficult to tell what you need to do to get your back feeling better. One way of approaching this problem is through what's called a treatment-based classification system. And what I mean by that is, instead of using one's anatomic diagnosis, say a disc herniation or a lumbar strain, for example, to guide your treatment, you guide your treatment based on certain characteristics that the individual has, combined with treatments that have been shown to be effective for people just like you based on evidence. How cool does that sound? The treatment framework that I use when I see patients for low back pain was developed by DeLitto et al., and it breaks down low back pain into 3 primary categories. And those categories are manipulation, stabilization, and specific exercise. And I'll actually go into what each of those mean in just a minute here. So research on the treatment-based classification system has shown that patients who were given treatments that matched their diagnostic classification group had better outcomes than those who received treatments that were not matched and did treatments for even another group. So what this tells us is that doing someone else's rehab plan for your own back may not always be effective, and in fact sometimes could be counterproductive entirely. Some people may feel great doing one certain exercise and may swear by it, but whereas when you do it, it actually increases your pain and makes you feel worse. So what this tells us is that back pain is not a universal standard issue, but rather is multifaceted and very individual in nature. Therefore, it's really important for us to match you as appropriately as possible for you to have the best possible outcome. The first group we're going to talk about today is the manipulation group, or as we can refer to them in this video, the Move More group. These are people who would benefit from treatments such as spinal manipulation and just simply getting that lumbar spine and those hips moving better again. So a lot of active range of motion exercises, some stretching to the hips in that area as well. And so the diagnostic criteria that we'll work with today are as follows. No pain going below the level of the knee. You can have pain going into the leg, but it can't go past the level of the knee. Pain onset should be relatively recent, less than 16 days. And you should have lack of lumbar range of motion in one or more planes and general lumbar stiffness. The more of those that you have, the more likely you fall into that category. And like I said, our guiding treatment for this classification group is going to be stuff like lumbar spine manipulation, active range of motion, mobility exercises, and general stretching to the muscles around the lumbar spine and the hips. All right, second group, the stabilization group, or the controlled motion group, as I'll call them. And these are patients who are essentially the opposite of the last group we talked about. These are patients who have too much motion and it's involved in the reason they're having pain. And so the criteria for this group are as follows. This population is usually younger, less than 40. They're going to be generally more flexible in general, so you'll see they'll have a straight leg raise, usually greater than 90 degrees. These are going to be your really flexible folks who can do stuff like touch the floor with their hands. And they might experience a catch, or what's called an aberrant motion in lumbar motion here. And so basically what happens with that is you start to notice when they're going to bend forward or bend back, there's a spot where they feel like a catch, and it kind of stops them in their tracks and they have to work around it. Or if they're coming up from bending forward, if they default to wanting to kind of walk their hands up their lap to take weight off of their back, that would be considered an aberrant motion as well. And so these patients are going to benefit from treatments that are focused on stabilization, a lot of core work, a lot of trunk control, and a lot of building up of those abdominal and low back muscles. So the last group we'll talk about is a little less cut and dry than the previous two, and that's the specific exercise group. The criteria for this group are as follows. You'll have pain going into the leg, going beyond the level of the buttock. So it has to go past your butt, it could go into your thigh, into your calf, down into your foot, but it has to go past the butt. It's going to be relieved by motion in one direction, either flexion or extension, and oftentimes feels worse going into the opposite direction. And so the way we treat this is with a whole lot of repetition in that relieving motion pattern. And the result that we're looking for is a phenomenon called centralization, which I'll discuss in the video that specifically goes over this whole process. There is actually a fourth category for this treatment classification group, and that is traction. And now traction actually for the lumbar spine has relatively poor evidence for it. And I personally do not use it very often with my own patients. So for the purpose of this video, it will not be discussed. So it's important to know that there are other criteria in these classifications that I didn't cover today because it would involve having a skilled physical therapist get their hands on you and perform their own assessment of you. And while this is something that I'm always a big proponent of, and if you have the ability to do so, I would highly recommend it, my intent with this video is to give you all something that you can use to try to treat your back on your own without needing to get that extra attention. So with that, here's a sort of self-diagnosis procedure that you can go through to help you figure out how you can best attack your low back pain and get back to doing the things you love pain-free. Step 1, stay calm. Don't freak out. Nothing good is going to come from catastrophizing your pain. Try to take deep breaths, remember it's going to be all right, and then take it from there. Step 2, ask yourself, do you have any symptoms going down your leg? If so, perform 3 to 5 sets of 10 lumbar prone press-ups and assess your symptoms then. Ask yourself, did my pain move any further up or down my leg? Did it make my pain feel any better or worse? You can try it again with flexion after and ask yourself the same question. If these motions changed where your pain is going down your leg, then you can be reasonably sure that the specific exercise group is going to be the one for you. Now be sure you check out my video on the specific exercise group because this is really only scratching the tip of the iceberg with regards to application. If you didn't experience any change with the specific exercises, ask yourself, does the pain go below the level of the knee? How old is your pain? If the pain is above the level of the knee and less than 2 weeks old, there's a reasonably good chance that the Move More group is going to be the one for you. So step 4, obviously this only leaves one group left, but I'm going to run through the criteria anyway. Are you on the younger side of things, generally more flexible, or do you experience any catch in your motion when you're performing lumbar movements? If any of that sounds like you, the stabilization group is where you need to go first. Now I understand that some of you may be thinking right now, man, this doesn't sound anything like me, and that's okay if you don't fit into any one of these categories perfectly. Simply pick the one that sounds most like you. You don't have to have all of the criteria to fit, and get started. I usually end up treating all of my low back pain patients with stabilization exercise at some point in their rehab. So it's totally normal for these categories to change and be dynamic over time as we progress. I also want to make one disclaimer, and that is that if you are having any persisting motor or sensation loss, meaning loss of strength, loss of feeling of touch in either of your lower extremities, or if you're experiencing any change in your bathroom habits associated with your lower back pain, you need to go and get that assessed by a medical professional ASAP, and I do not recommend you try to rehab alone. Now that you know which group you belong to, check out the other videos on each of the classifications for more information and treatment ideas on what you can be doing to get yourself back on track as soon as possible. Thank you for watching, and happy training.